guys, good afternoon. Today, welcome back to my YouTube channel. Thank you again for tuning in. If you're new to this channel, welcome aboard, welcome to this family. And if you like these types of educational material, please give me a thumbs up and please subscribe to my YouTube channel. I come every so often. I upload new content twice a week on different educational material. So please subscribe to this channel, please give me a thumbs up, please like and share these videos. So today I want to talk a little bit about the state board exam for the certified nursing assistants. So in order to be a certified nursing assistant, you must complete the didactic component and school, a licensed professional school. You must complete the didactic, and you also must complete the clinical skills. So when you complete CNA school, you will be eligible to take the state board exam to get your state board certification. So the state board certification consists of two components. You have the didactic aspect where you're going to be taking questions on a computer, and you must pass the didactic component. Then you'll move on to the clinical skills. So the clinical skills, you have to complete 3 skills, and those skills will be chosen by the proctor, whoever is giving you administering the exam. You will be completing, they'll give you 3 skills. It could be hand hygiene, it could be transferring a patient from a bed to a wheelchair, or it could be annulating a resident with a gait belt. So regardless of any skills you get, you have to do certain things. And today I am going to explain the indirect skill that you need to do for each one of these skills. I have them written down on my computer here. So I am going to be looking down here and I'm going to be reading some of these skills. They're called the indirect skill before you actually get to the direct skill. So that makes sense in any way? So the first one is to greet the resident. Address the resident by his or her name and introduce yourself. Tell them what's your name. And the second one is to provide explanation to the resident about the care before beginning and during care. So just don't go there and start doing foot care then. Tell the resident, explain to the resident, Mr. So-and-so, I am here to provide you with mouth care. So you explain, that way it will decrease the anxiety of your patient or your resident. They call them residents in the nursing home because they live there for 24/7, and they call them residents. So explain exactly what you're there for. So the third element of the indirect skill is to ask the resident about any preference during care. So by asking the resident of their preference during care, you're promoting comfort and you're making the resident feel like, you're showing empathy and you're being compassionate as a nursing assistant. The fourth element is to use standard precautions and infection control measures when providing care before and after. So before you perform your care, you have to perform hand hygiene because you were taught that. During nursing school, you were taught to perform hand hygiene, washing your hands, using soap and water for 15 to 20 seconds. So you must perform hand hygiene. That's practicing good infection control. So the fifth one is to ask the resident about comfort or need during care or before or after care. How do you promote comfort? Ask the patient, are you in pain? You can use pillows to promote comfort also. You can give them a back massage. So you have to ask them about anything that are you experiencing pain? And that way you're showing that you're promoting comfort and you're being empathetic. And the sixth one, promote resident rights during care. How do you promote residents' rights during care? That's a sixth element of the indirect care. You're promoting residents' right during care by pulling the privacy curtain. Maintain the patient privacy during care and after care. That way you're promoting the patient's rights to privacy. The seventh element is to promote the resident's safety during care and after care. How do you promote a resident's safety during and after care? For example, you're promoting safety by raising the bed to working level. You're also maintaining proper body mechanics. When you're leaving the residence, you make sure you're leaving the bed in the lowest position. You're putting the call bell within close reach. That's the way how you are promoting safety during and after care. So guys, these are the seven components or seven elements of indirect care. If you are taking the state board exam, make sure you integrate these seven elements of indirect care, so you can because you are judged by the indirect scale and also the direct scale. So integrate these seven elements in your indirect care, and that way you can optimize your chances of passing the state board exam. Again, if you like these types of videos and these types of content material, I upload new content twice a week. Please consider smashing the subscribe button, like and share these contents, and drop your comments below. Let me know what else you would like me to provide you with. Thank you so much for watching. Thank you for my subscribers. If you're new here, please consider subscribing to this channel. Thank you so much, and I'm out. Bye for now.